All right, hey guys. I was just consulting with the patients. Sorry for being late here. Let me write your questions below. And today we're gonna talk about lipedema recovery after LippyLipo. And I love it. Okay. So, been getting a lot of questions about recovery after the procedure. Second here. Okay, I think now we're back. All right, so you get the procedure done. Afterwards is you want to maintain the compression for 5 days. And the reason for that is most of the time, especially in patients who are stage 2, 3, 4, we're taking 5 liters out. So when you take 5 liters out, even though the body is swollen, the intravascular system, the fluid inside the vessels are depleted. And people are like lightheaded, we call that vasovagal or dizzy. So you want to make sure like you're hydrating as well and you keep the compression, because the moment you take the compression off, fluid's going to come to the outside the blood vessels and then you're going to feel lightheaded. So we found out that by leaving the compression on for 5 days, that amount of dizziness after the procedure doesn't happen as much. So now we keep everyone keeping the compression for 5 days. You can shower having the compression on 2 days after the procedure, and then you blow dry it on the cool setting, because after the procedure the nerves are still like kind of like numb. So we don't want anybody to burn themselves by being too hot. So put it on cool, blow dry it, and you can still shower 2 days after the procedure. And I know it's annoying like keeping that compression for 5 days, because like, you know, you have blood on it and the fluid and that. But if you take it sooner, really like the dizziness and all that stuff, it's kind of like much worse. Kind of like, which one do you want in life? So we found like keeping that, it's really much better. Other than that, the common questions we get is what type of like vitamins, supplements that I need to do. Now, definitely you want to precondition your body in terms of your blood count. And we're talking mainly about iron here, iron. And that can be in terms of supplements, in terms of spinach, in terms of pills. People who eat red meat helps with that. For people who have low vitamin B12, also that replenishes the blood count. Because the higher the blood count you're starting at, the better your recovery is going to be. Because if you think about it, if you take 5 liters out and we're injecting fluid in, so your blood count is going to go down based on the injection. So you have like hemodilution, you have the dilutional part, so your body is going to feel weak. And also if there's any blood in the lipoaspirate, also your blood count is going to be lower. So your recovery is going to be harder than somebody, let's say if you drop by 2 points, and if you start here, you drop by 2 points, you'll be here. But if you start here and you drop by 2 points, your after recovery will be like your pre-procedure. So it's very important to precondition yourself beforehand. Definitely magnesium helps a lot, especially for muscle twitching. The cases, they take about 4 hours, and the position, people can feel like within certain position, they feel like the muscle will twitch. So we'll have them on magnesium before and magnesium after. So really, like if you're at home, vitamin C helps a lot. It helps also with iron absorption. So you want to do like vitamin C, vitamin B12, iron, calcium, magnesium, zinc, all that stuff is very important. And you want to start that like, you know, as early as you can, and you want to maintain it after. Now, when you do take iron, make sure you're on a stool softener, especially if you are prone for constipation, because the oxy afterwards, even though most people, they use it only for like 2 days afterwards, it can also cause constipation. So between the iron and the oxy and the stress of the surgery, you're more likely to be constipated. So you want to be on like Colace or Senna or the laxative, some sort, to really so that you don't get constipation. So you don't want to have to deal with that in your early recovery phase. So that's kind of like a rough kind of estimate. Now, on the consultation here, our patient was asking me, is like, okay, in terms of recovery, when do I feel like going back to normal life? It's really about 6 to 8 weeks, like after, especially if you're getting 2 procedures done in 1 week, taking 10 liters out, really for the body to feel like the way it was before the procedure, we're talking 6 to 8 weeks. Now that being said, to go back to work and kind of regular stuff, 1 week after like your second session or 1 week after your original procedure. So kind of like that's looking at it. LippyLipo has been a game changer, and part of the reason is totally awake. So people are not going under general anesthesia. The risk of DVT, PE, all that stuff, it's not there. People are not being paralyzed, they're not intubated, they're not like on the vent, or you kind of like, so basically it's you're getting the lipedema fat cells removed and you just walk out. So that allowed the procedure to be much safer, easier recovery, going back to normal life kind of like much faster. What else? Another question I keep on getting is like, DVT, blood clots with that. Again, being awake, normally blood clots, they happen with general anesthesia on induction. Like, during induction, the blood pressure goes down, circulation is down, and then usually blood clots happens on induction. And then that's people, they throw a DVT or a PE, during that. But awake, that's out of the equation. And then the next question is fat embolism. Again, we haven't seen it. Part of the fat embolism is fat transfer during BBL. If the injection is done below the muscle, that's where the veins are. That's kind of what happens. With regular liposuction, if the plane is not violated, if the muscle plane is not violated, the risk of fat embolism is almost zero. And if you're awake, guess what? You're gonna feel it. If that cannula touches the muscle, you're gonna feel it. So that's why it's like super safe, especially on somebody with the higher stages of lipedema. You wanna be awake because one, it's less tender. The higher the stages, the less tender you are. Second, especially for the novice surgeon, it's very hard to know where that cannula is, especially if somebody is that thick. Because if you're thinking you're sucking here and then they go here, they might not know that. So really but being awake, you're gonna know, and you're gonna tell the surgeons like, hey, I feel, like that's hitting the muscle. You're gonna know if it's something hitting the muscle. So, because the muscle is not being numb, it's just the fat that's being numb. So it's really been a game changer here. So let's go over some of the questions we've been getting here. I'm gonna scroll all the way up so that we don't miss anyone. There's a lot of hellos and waves from our awesome, some of them are patients and some of our followers as well. Heather Grace is asking, do you diagnose and bill to insurance? We don't. We are not in network with any insurance. Our practice is very selective practice, we're very exclusive. I only do 1 surgery a day, and I spend all my time with 1 patient all day. And the reason for that is quality. I want to make sure every patient that comes through our door, they get the best outcome possible and the best experience possible. And to be able to do that, it's usually taking us around 4 hours to do a single case. And this is just the case itself. And you have like about an hour before, an hour after. So you're talking 4 to 6 hours. So it really takes the entire day to be able to deliver that. And we get about 500 inquiries a week. And I can only do 1 surgery a day. And this is without doing insurance, without doing billing, if we open it to insurance, we would be getting maybe 10,000 a week. So it's just like, in what we do, it doesn't work out. And with that, kind of talking about that, and I mentioned that kind of in the previous live, if you think about you having the procedure done, I think Jerry now is booking like after the summer. So, and we're booking very fast. So I would just like immediately send the papers now so that we can kind of get you in, especially if you want to get it done within this year. Because again, the way we're doing. And that's why imagine if you open to insurance, we'll probably be booked for the next 10 years. So we're kind of extremely selective. And we don't do diagnosis, again, because we're not in network with insurance. All due to quality. To me, is quality. I was late for this live, and I'm very punctual. And the reason I was late because I was in a consultation with a patient, and she's awesome, and she had a lot of questions and a lot of great questions. So my job is to give all my time to our patients. So and that's kind of that's how it is. And you come first, and that, you know, quality takes time and takes attention to detail and listening and going over all the options and answering all the questions we have. Okay, next one we have is Sylvia. Doctor, do you operate on Brazil? So I only operate in the United States and only operate in one location. Even within the US, I get invited to operate either in meetings or operate on in different places with other surgeons. I don't, and part of the reason is to maintain quality. With LippyLipo, it really takes like an amazing team. Everything is perfectionized. We do everything kind of like step by step to be able to deliver consistent outcomes to our patient. I want consistent, amazing experience and consistently amazing results. And that's, you know, that's why we are who we are. It's because we're consistent in providing that data, and we provide immediate outcome, immediate result on the table. So every patient that comes here, take a picture, take a video, show it to them, show how awesome they're looking, minimize the recovery, make sure the fat is good quality, we'll make sure we're minimizing any blood loss, and to deliver the dream that they came here for at first place. So in a nutshell, we don't operate in the in Brazil. Sarah is asking, hi doctor, how can I know the difference if I have lipedema or cellulite? So, you know, good question. Lipedema is commonly misdiagnosed with few things. Obesity, some people say, oh, you're just fat, and you actually patients have lipedema. Or hey, you have cellulite, a lot of cellulite on front of the legs, back of the legs. That's not cellulite, that's lipedema or lymphedema. So it can be obesity, it can be lymphedema, or it can be cellulite, or it can be pure lipedema. The way to tell at home if you have cellulite or lipedema, and you're gonna know that. So basically the signs and symptoms of lipedema. So we can start with the signs of lipedema. If you have a tree trunk appearance of the legs, or the pear-shaped shape, if you have easy bruising, if you have a cut-off sign at the ankle, if you have pain on pressure, if you like, you know, if somebody is touching the fat and you get pain, or like blood pressure. I was talking to a patient, like she always thought like blood pressure cuff. She gets pain from it all the time, and she thought this is normal with kind of like her body. It's not. If you're having that, probably you have lipedema. If you have like a pet and the pet comes on your thighs and then you have pain, or if your significant other is touching you and it's like, then that's probably lipedema. It's tenderness. Tenderness to touch is lipedema. Easy bruising is lipedema. The shape is lipedema. Swelling, wearing compression. If you don't wear compression, you get swelling. This is lipedema. We're talking about water pill. A lot of patients with lipedema are on water pill. The problem is, and no one can figure that out, they have normal kidneys. How come they're having swelling and normal heart, right? I mean, because think about it. If you have swelling, right? I mean, either it's a kidney problem or it's a heart problem. But these people have great heart, they have great kidneys, and they have lipedema that's not diagnosed. And they are on a water pill. Now, it does help it, because edema is swelling, lipid is fat, so it's swelling of the fat. So it does help, water pill does help lipedema, but it's not the solution to the problem. The problem is the lipedema, it's fixing the lipedema, and when you fix the lipedema, the odds of them needing a water pill is much less. It's like the same thing doing knee replacement for somebody with stage 3 or 4 lipedema. I mean, the problem is not the knee. The problem that the knee got damaged is because of the stage 3, 4 lipedema over many, many years, wear and tear of that original knee. So doing knee replacement, yes, you're fixing, it's a band-aid to the problem. The real problem is getting rid of the lipedema fat. And the same thing with swelling, the same thing with that. So to go back to your question here, Sarah, lipedema versus cellulite. If you have those signs and symptoms, it's more likely to be lipedema. But if you don't, then it's more likely to be cellulite. If you look at our pictures, the before and after, a lot of patients are actually self-diagnosing themselves. They look at the pictures like, oh my God, I have those legs. Then you know it's those legs are your legs, and then kind of like, you know, you have lipedema. Good question. Let's keep on going here. From Michelle. Hey Michelle. How much iron? I'm taking 25 milligram of chelated iron and it doesn't cause bowel issues. You know, that's a great question. We get asked this question a lot about how many milligrams of iron, chelated, non-chelated, and all that stuff. And I've always been very careful about recommending like how many tablets or how many doses. And the reason for that is I'm worried that somebody is gonna take something off the shelf that have different dosing and then they get the wrong doses. So what I tell people, like, you know, there's few good, like, you know, off the shelf stuff like Mother Nature and kind of like different things that or Nature's Best. So like get that and look at the directions and always go with the highest recommendation on that, so that we don't overdose somebody. And the key thing with iron is a lot of it, I'm glad it's not causing constipation, but with our patient, most of them, it does cause constipation, especially when they start the oxy. Because I tell patients, like, take one oxy the day after your procedure, that night after your procedure, so that you get a good night's sleep. Even if you're not feeling pain, just take it. It's just gonna make you feel better. It can cause constipation. So the iron and that combination and the stress of the surgery can cause constipation. So I'll be like, and it's better. And if constipation occurs, you can tell on the recovery, like they don't feel good. Like, you know, it's just that feeling of constipation. So the better treatment is to treat it before it happens, so it doesn't happen. We know it's gonna be constipated. So maximize on the iron and start it. The other question we get asked about iron: how soon to start and how long before and how long after. The more, the better. Obviously, the more you precondition yourself, the better it's gonna be. And then afterwards, usually 6 to 8 weeks. Once you feel your back at your blood, everything is good, then you're good. Then you can stop it at 8 weeks. But before, if you can do it 2, 3 months, 4 months, it's even, as long as it's not causing like major GI symptoms. Now, that being said, if your preoperative hemoglobin is 16, then you probably don't need the iron. I mean, maybe take a lower dose. So that's why it depends on the person. So you want to see where you are. Like I was talking to a patient now, her hemoglobin is 12.2. So, and she's looking at like multiple procedures. She might ultimately need 10 procedures to be done with all her body. And she's starting at 12.2, and then she's coming to us from our state. So it will make sense to do 2 procedures in 1 week. But starting at 12, and I haven't done any procedure on her yet, so I don't know her quality of fat, how it's gonna be. So we wanna precondition her body so that she's starting at a higher hemoglobin level. So that person will need a higher dose. So Sarah is asking about lipedema and cellulite. We answered that. DJ Pari is asking, if you gain weight after the procedure, you will gain in other places. You know, that's a good question. Ideally, you really want to maintain good lifestyle after your lipedema surgery. For 2 reasons. One is you don't want to gain regular fat. Second, you don't want, especially sugar. Sugar is really bad for lipedema fat cells. So the way I look at it is you want to starve it. You want to starve those lipedema fat cells so that they don't have, you minimize the chances of regrowth. It's a very low percentage. And we were just talking about that, kind of like regrowth. Again, we haven't had it, but I'm sure at some point somebody is going to have it. So, but that being said, it's very low. We're talking less than 5% regrowth rate. So you want to starve it so that we don't even give it the chance of 5%. So we keep it on the lower chance. But let's say life happens, somebody eats and then they gain weight. Is you will gain it where the regular fat cells are, or let's say if somebody has lipedema in their arms and these were not treated, and you eat sugar, you might flare in those areas. So you want to really maintain a healthy lifestyle afterwards to minimize flaring, especially in areas that you haven't treated and or areas where you have regular fat. The areas that are treated, when those lipedema fat cells are removed, they're usually removed. It's very unusual to gain it back in those areas because the fat cells are gone, so the body is not gonna store, it cannot store. That storage cabinet is gone. There's other storage cabinets in the body would store them there. They will not store them in the area that was treated. I hope that answers your question. So let's keep going here. I love these sessions, guys. Like every time, a lot of great information. Beauty by Max is asking, would a high-profile implants stay up and perky and hold its shape longer? I mean, that's a good question. We're only specializing, and our lives are only about LippyLipo procedures, so we will limit all the questions to liposuction for lipedema, just to be able to answer all our lipedema patients. CM is asking, what can we do to get more of the medical community to know about lipedema? You know, that's a great question. Raising awareness. We're very active about raising awareness among the medical community, and that's by going and giving talks. I'm pretty much involved in almost every single conference. Every month we're flying somewhere to talk about lipedema and LippyLipo and kind of like what to do about it. So we're going to FDRS in I think March or April. Then we're going to the Aesthetic Society in May. Then in June, we're going to the International Society in Cartagena, Colombia. In September, there's a lipedema event with Dr. Schreiber in London. I mean, we're like very active just to put it across the medical community. And patients, you guys have been doing a great job. Like, you know, a lot of people are talking about it. Definitely there's more awareness now than it was like 2 years ago for lipedema. So things are moving are moving forward. And we do a lot of lives, you know, it spreads a lot of awareness. I do get a lot of DMs afterwards, people kind of like really getting a lot of knowledge from them. So that's an amazing question. And you know what? Even with all that, we're probably like 1%. Just looking at all the comments we get, a lot of people have no idea what lipedema is. Even among the medical community, people have no idea what it is. SZ Mankey Travels is asking, do you have a weight BMI limit above which you do not take any patients? You know, that's a great question. I don't like to link BMI and lipedema patients together. There's no value because, let me explain something. Most of patients who have lipedema have high BMI. Stage 4 lipedema patient, I guarantee you that BMI is going to be more than 40. Most of them. But it doesn't mean that BMI is more than 40 because they are obese. BMI, it was done for obesity, like not for lipedema patients. So it's not fair to compare, you know, if you want to compare apples to apples, we need to have a lipedema BMI scale, not a regular BMI. It doesn't work. So the short answer to your question, I don't care about the BMI. I just don't. We did yesterday, now we've done BMIs of 18, stage 1, 18, they look amazing. And yesterday we did a case where BMI was 48. And I was just consulting with a patient, her BMI is in the 50s, literally before this phone call. And her BMI was at some point 60, so there's no limit. Imagine, let's say if we say, oh, you know what, above 35, we're not gonna touch anyone. It doesn't work because like, then what do you do with probably 50, I don't know what the numbers are, but I mean, a vast majority of lipedema patients have a BMI more than 35. Then what do we do with those patients? We say, hey, you know what, you're actually above, and now they cannot lose weight. We know massive weight loss doesn't work with lipedema. We know the Ozempic, Mounjaro, all those new medications that are good on the weight, on the regular fat, not the lipedema fat cells. Diet and exercise doesn't work. Then that means that person, we shouldn't touch her. Like, you know, if we don't do anything, nothing's going to happen to her. It's going to get worse. She's going to need replacement, ultimately become disabled. She cannot walk, all that stuff, because there's no solution. And if she's going to do it under general anesthesia, she's high risk because she's above 35 or 40. A lot of people won't put her to sleep. And that's why, like with LippyLipo, patients are awake. So we were able to actually help so many people that would have otherwise not being able to be helped, and give them amazing cosmetic outcome, and improve their symptoms, and make them feel better, and at the same time treat the patients with a lower BMI, give them an amazing cosmetic outcome. So the answer to the question is, as long as somebody, BMI, you can be 30, 40, 50, it doesn't matter. It really doesn't. What really matters though is what's your blood count, because we want to make sure, you know, we're safe. what's your medical history, any heart problems, any lung problems, any strokes, any like stuff like that. Yes, those matters for safety. And then at some point you can't because it's not safe. But if somebody is healthy and they have a high BMI, it's actually, that's their window to get it done. Because if they don't, then the medical is gonna get affected, and then they're gonna reach a point where they cannot have anything done. So it's actually the other way around, if you really think about it. So, high BMI, healthy, you gotta do it. Because that's your window to do it. Like our patient now, I mean, she's great. She's in her 50s, she's healthy, she's young. That's her window. Doesn't do anything, health problems, God forbid, heart problems, stuff like that. Now she's not a candidate. She's on the blood thinners, she's not a candidate. Now she needs clearance, all that stuff. Now you can't do anything. She's already not a candidate for general anesthesia. So like that patient is stuck. So people have a window and you don't want to miss that window on the higher BMI. So, Azimanki is asking, do you operate on patients that have lymphedema as well? Lipolymphedema, absolutely. So, good question. So, lipedema has 4 stages. You got stage 1, stage 2, stage 3. When you go to stage 4, your lipedema progresses and becomes lipolymphedema. The treatment is the same. It's still liposuction. Now, if somebody has isolated lymphedema, one leg typical lymphedema, different treatment. We don't treat those patients. But somebody who progressed from stage 1, 2, 3, 4, stage 4 lipolymphedema, and these patients have higher BMI. So it kind of goes along with your questions, and I cannot tell what your body habitus you have and kind of like what you're suffering from because of the lipolymphedema stage 4. So what you're asking about is a stage 4 lymphedema, higher BMI. If you're healthy, yes. Stage 4 lymphedema with heart problems, stents, blood thinners, strokes, stuff like that, you're not a candidate for LippyLipo. And just kind of so you know, because of safety issues. But if not, that's your solution now. That's your window to get it done. And again, I'm not saying that we're booking guys after the summer. Like, with limited amount of spot what we have. But I'm trying to add as much information as possible and as much knowledge as possible so you know, because in the medical field, you cannot find this information anywhere. Like, unfortunately, just like, it's not in any book. Like, no one has that, like, this information. So share it, send it to others, send it to your primary care physician. I'm always available to get any phone calls, anything we can add value to be able to help the lipedema population. That's really kind of what we're trying to do here. Very good question. So let's keep on scrolling over the Panda Cabo is saying, you bring light to something that has plagued women for a long time. Thank you so much. I'm too old for this, but many will get relief if they get your help. It would be life-changing. Thank you. You're so sweet. Thank you for sharing that with us. And you're right. Unfortunately, you're right. Unfortunately, many women are in their 80s that reach out to me and say, I wish I knew that. But you know what? They feel better because now they know. All what they thought about their entire life, they knew something wasn't right and they knew that no one could understand. And now it just confirmed what they believed and what they knew all along from 50 years ago. Kind of like all that. And that's kind of what we're trying to do. So I'm glad that makes you feel better and kind of know kind of what you have. That brings me joy. Because again, we want to raise as much awareness as possible in the medical community and among our lipedema community as well. Carol is asking, what's the particularity of LippyLipo technique compared to Vaser, Wall, etc.? Good question. So LippyLipo, it's a proprietary and I cannot share much about it because we're in the process of trademarking the technique. But I can tell you kind of a little bit about what LippyLipo is. The others I cannot tell you because I don't use them, so I'm not very familiar with them. But I'll tell you about LippyLipo. It's done totally awake. So there's no IV sedation, no PO sedation, there's no general anesthesia. So it's like you and I were talking now, so purely awake. What I love about awake is the risk of blood clots is minimal. Patients are part of the decision making. They're moving, they're moving around. They see the outcome immediately on table. So if there's anything that they see I don't see, I go back and kind of take care of it on the spot. The recovery is much faster because they're fully awake. The technique is less traumatizing, so that they're walking out. Every patient walks out of here. They walk in, they walk out. So that's been a game changer. The outcomes are amazing, like consistently amazing. Every patient, like think about that. Every patient that we get, if they consent, we're posting the results. Like this is how good it is. It's not like with cherry picking, oh, this is good, this is not good. No, it's good, it's gonna be good. If you consent, we're gonna post it. And that's why you see like, oh my God, every result is amazing. And that's LippyLipo. It's really been a game changer. So the results are there, the immediate outcome is there, the recovery is very fast. So it's just a win from every angle. And that coming from me, who I used to do them under general anesthesia. And I've done several hundreds of lipedema patients on great outcome. And I was using tumescent anesthesia, power assisted, and it was great outcome, very happy patients. But I'm telling you, when I switched to LippyLipo, my God, I mean, the patient experience was better, the relationship was better, patient was awake. It's just been a game changer. So that's why I would never go back to general anesthesia. I would never go back. If that was my wife, I would never do it under general anesthesia. I'll do LippyLipo on her. So it's been a game changer. Let's keep on going on the questions. Sarah, thank you. You're welcome. Gotta be is I sent my consult form yesterday. I've had 5 babies close together and noticed a change with the last 2 pregnancies in lipedema progression. Well, let's talk about the process of, so when you send your paper, so patients are usually sending the new patient, paper form, basically the history, past medical history, past surgical histories, allergies, medications, and what procedures they're looking for. And then they're also sending their photos. I review everything. I review the photos and the patient paperwork. And if you're a candidate, then we move you to a virtual consultation. And if you're not a candidate, we would reach out and tell you why you're not a candidate for LippyLipo. And the reason we're doing it this way, we get significant amount of patients who apply to us for LippyLipo, but not all of them are candidates for LippyLipo. For example, if somebody doesn't have lipedema, even though we can still do LippyLipo and give them amazing outcome, we're not offering our services because we're just helping lipedema patients. Or if somebody is interested in breast augmentation, even though we can do it, we do a great job, we do it awake actually, we're still not accepting those as patients because we're giving out. So, or if somebody who doesn't have lipedema or they need something else, then I review them and then we reach out, say that. But if you are a candidate, then we move you to a virtual consultation and we take it from there. And that process usually takes 1 to 2 business days. So, and I reviewed all the papers. I've consistently reviewed them. So our team will be reaching out to you. In terms of mentioning that the last 2 pregnancies your lipedema progressed, we know for a fact lipedema is hormonal. It's response to hormonal changes. That's why it gets worse with puberty, worse with pregnancies, worse with menopause. So it can be in first pregnancy, second, third, depend on which some pregnancies can hit lipedema different because the hormones can be different with different pregnancies. So what you're saying is actually true, and we've seen it over and over again. Lipedema does progress with different pregnancies. And if you're not menopausal, ultimately at menopause, it will also progress. And that's why I tell patients, if you're about to hit menopause, treat your lipedema prior to menopause. If you're planning on getting pregnancies in the next few years, treat it before so that it doesn't progress in pregnancies. And that's kind of so that the amount of procedures is less, the amount of skin stretching is less, and you potentially prevent progression of the disease to late stages. Okay, let's keep on going here. From Sopita, I think she's saying if I speak Spanish. I don't, but I speak French and English and Lebanese. So if you want to write in those 3 languages, I'm happy to answer. Let's keep on going. Good question. Michelle is saying, I tore my ACL 7 years ago and never got it corrected. I cycle about 15-25 miles a day. Wow, that's impressive, Michelle. That's awesome. Good for you. Is the cannula going to hit the ACL knee area? Good question. It's not. So the fat sits between the lipedema fat sits between the dermis, between the skin and the muscle. It's not gonna hit anything like that. That's why we're able to do LippyLipo on patients who had knee replacement in the past. Because it's in a different, even though the orthopedic surgeon or that, they go through those to get to where they wanna get, the area where we work with is in a different plane than that area. So the answer is yes, we will treat it and we will not hit that area. And that's the beauty of LippyLipo, you're awake. So basically, if you get close to that area, you're gonna feel it. You're gonna know, I'm gonna know. So which is really cool. If you're asleep, obviously you're asleep, you can't feel it, and the surgeon doesn't have a feedback from the patient, so they won't know if they are close to that area. Especially in somebody who hasn't done hundreds of lipedema, that is like a very steep learning curve to get it to this point. And I do talk a lot about that in meetings, and when other lipedema surgeons reach out to me about certain cases, it's like there are ways of like curved cannulas and techniques you can really go around that area and then still clean it and remove the lipedema without having to hit any of these structures. But it does take, unfortunately, it does take time and effort to teach it to people. Okay, Lula is saying, are there other treatments other than surgery? You know, that's the conservative treatment other than surgeries. And the people who are, like a lot of our patients are now like, we're booking months, later. So like, meanwhile, I'm like, do conservative treatment because it helps a lot. Diet is key. Like, having lipedema diet is very important. Also, compression is key. Manual lymphatic drainage is key. All that stuff, it helps tremendously with lipedema. Aqua therapy has been very good to lipedema patients, especially late stages where the knees and that is being hit. Diet, compression, MLD, manual lymphatic drainage, all that stuff really helps a lot. Vitamins helps a lot. So there's a lot of, it's a huge entity, which the non-surgical treatment of, which is important because you would need that for after your lipedema surgery as well. It's not like one or the other, it's both. And it's not like just surgery and don't worry about the others. It's not good. And vice versa. It's not like just do that and don't do the surgery, because you can potentially progress even being on conservative treatment. You need both. Yossi is saying, how can I schedule a consultation and the price? So to schedule a consultation, link in bio, and you can't directly schedule a consultation. You have to request a consultation, and the way to request it is by filling the information and sending us your pictures. I'll take a look at that, and then if you're a candidate, then we move you to a consultation. And if you're not a candidate, we'll let you know why you're not a candidate and what we would recommend for you. For pricing, the MS for pricing. I'm scrolling down here. This is so much fun, guys. I really enjoy it. I love those lives. It's kind of sitting here, answering the questions, and it's just a joy. Katie is asking, is every case different meaning the amount of incisions can be different? You know, that's a very good question. And we have two questions here. The first question is every case different? Yes. Because, I mean, your right hand and left hand are different. The right breast and left breast is different. The right leg and the left leg are different. You know, right face, left face, everything is different, right? So imagine within the same person, you're different, and different people, they have different, you know, different DNA, different genetics, different quality of lipedema fat cells. So yes, so is every case different? Yes. Is every amount it's going to be different? Yes. That being said, if somebody late stages, we're maximizing 5 liters on almost everyone, unless there is a reason not to answer that part. Now, let's talk about the amount of incisions, depending on the area. So, like everything in life, there is a sweet spot. Too much of incisions that not making any sense on the contour and the amount of fat, it's not smart. You know, like you don't want too much incisions, like you want to minimize that. So it's a bell shape curve. You want to have the most amount of the least amount of incisions to get you the best outcome possible and the most amount of fat possible and the least amount of contour irregularities possible. If you go too little on the incisions, the price that you pay is, even though you're lower on the incisions, the problem with that is contour irregularities and missing certain fat pads that you won't be able to get. Too much incisions, there's no reason. You have two more incisions than you need to. The key is to have the perfect amount of incisions, where you're able to get the best outcome possible, the best shape possible, treat all the lipedema fat cells, or most of the lipedema fat cells, with the least amount of incisions. And that's why it really, like, going to an expert, having somebody, like, that's all what we do. All what we do is LippyLipo, and that's kind of with consistent giving that, and it's really the value is like infinite on that, and I love it. Like you guys, the questions are like unbelievably good, like they're amazingly good, and I couldn't agree more. I mean, they're really good questions. And okay, next question. Birthday Cake 27 asking, do you do breast lift? Again, do I do it? I don't now. I used to do it. All what I do is I specialize in LippyLipo for lipedema. Because of the high demand, again, we get 500 inquiries a week, and I only do 1 surgery a day. 1 surgery. So we've been saying no to many patients, unfortunately, but at the same time, because I really want to help the lipedema population. Like, it's just kind of like, there's only one of me and I can just do one thing. And I selected LippyLipo, and kind of, you know, when we invented LippyLipo and seeing how well our lipedema patients are doing, so that's all what we offer. And we're booking now end of summer. So if you want your procedure done, you gotta make sure you send your info now, because otherwise it's gonna be much later from the way we're booking. Okay, next question from Trini Eyes is asking, hi, I love your work. Can you please send prices? Thank you. And for prices, you can DM us for the starting price. Josie Lynn is asking, do you help get rid of cellulite? Good question. If the cellulite is from lipedema, so if that waviness is a cellulite, it's a lipedema waviness that people are misdiagnosing it with cellulite, then yes, that will take care of it. But for regular cellulite, the treatment is different. LippyLipo can help, but I'm only treating lipedema patients. Thank you. God bless you. God bless you as well. Keep on going over the questions here. Linda is asking, what's the typical cost for LippyLipo? For cost, DM us for pricing. The other question, is it safe near the ankles? It's very safe in the right hands. That's why you see a lot of surgeons don't do knees down, because it's very challenging areas, and say it's not safe, it's not. They are right. It's not safe for them to do. It's like me doing neurosurgery. So, I mean, it's not safe for me to do it. It doesn't mean neurosurgery, it's not safe. You know, in the right hand, the person who's the best in the world for neurosurgery, yes, it's safe in their hands, you know. So, I mean, that's this with anything, but we've done, and I'll tell you, like, based on our data, we've done hundreds of lipedema liposuction, and we never had any issues on the ankles in the right hand. So to answer your question, it's very safe. And you want to treat it earlier than later, because progression of the ankle area becomes fibrosis, much harder to treat and much harder to get like an amazing cosmetic outcome. The key with lipedema, guys, is early treatment. Stage 1, stage 2, treat it. Don't wait until it becomes stage 4 lipolymphedema. It's very hard to get a good cosmetic outcome, and now you need more procedures to do it, and now you're gonna need skin resection, and it's just like, just treat it earlier. Let's keep on going here. From Busto, Angela, will you only do the calves? I did a consultation and there's no way I can afford. You know, good questions. You can't, with lipedema, that's actually an amazing question. The issue when people, lipedema affects the limb in a 360-degree fashion. If you only treat one area, it's not gonna look normal. And God forbid, if you have a flare in the future, the area around it is gonna flare, and now you're gonna have a sunken hole over the calf, that treated area. You almost never wanna treat just one area. You always wanna do 360 and clean the entire subunit. I don't do any revisions from other surgeons. You know, we only take care of our patients. But when I get patients kind of for the consultation who had issue, we call it like like limited area, like, you know, pick and choose from other places. It's very hard to fix because this area are scarred down. It's spot treatment, and patients have 360 lipedema. Now you have to redo the area, potentially inject fat, equalize fat to the area so that the shape, you get the shape, and that's very hard to do. So I would save and then do it right versus doing spot treatment, because now you're stuck. If you do a spot treatment to a lipedema patient, that tells you, one, the surgeon that's gonna do you doesn't know about lipedema, and if they know about lipedema and they're doing a spot treatment, that's a red flag, run away. Like, it's no joke, because now you're in a really bad position. Okay, next question from Verse is, I had a tummy tuck, 9 months, fluid was forming under my skin, surgery site for lymphoma surgery, is that for the, you know, based on your question, probably it looks like you had this seroma, or it's very hard with a tummy tuck. LippyLipo is a different ballgame, guys. There's no resection. The risk that you had with thigh lifts, tummy tuck, all that stuff, it's not there. You know, like, could you have a small seroma? It's good. We never had it with lipedema. It doesn't mean it's zero. It's less than 1%. So it's very, very safe. Like, it's one of the safest cosmetic surgery that you can have, or, you know, or plastic surgery that you can have. Vanessa is asking, the lipedema can come back after surgery? Good question. The risk of regrowth is less than 5%. And if it does come back, it doesn't come back like it was before surgery. It's very, very, very low chances of regrowth. That's why it's very important to maintain healthy diet and exercise to keep it at bay. SZ Mankey is saying, thank you for your precious answers. For high BMI patients, you're welcome. For high BMI patients, do you still think it makes sense to take Ozempic to try to reduce normal, not lippy fat? You know what, that's a great question. And my thought is, if you are able to reduce your regular fat, it's better, because the amount of procedures you will need with LippyLipo will be less. So absolutely, and we've had a lot of patients with the new generation medications who are able to lose the regular fat. So absolutely, if you're able to do that, do it, because you would need much less procedures to be able to get to where you need to get. And we do have like few patients where the Ozempic, Mounjaro and that are taking those, and they had good success with it. So to answer your question, yes, I would do it if I was you. It makes sense. Now obviously there are side effects that comes with these medications, right? I'm not like, you know, I have no association with those medications, but you want to make sure you're followed by primary care, you know the side effects, you know kind of like what you're getting out of it. But yes, drop it. If you can drop regular fat with diet and exercise, because you can still, the regular fat, diet and exercise, all that stuff can drop it. You want to drop them as much as possible. Mother of AA Sia is saying, do you do leg lifts as well as lipo? We don't. We do LippyLipo, and for the skin resection, we have our patients do the skin resection at their home state. Most of our patients, they fly to us, okay, they're out of state. The problem with skin resection is it has a higher complication rate than regular LippyLipo. Either this skin spitting, infection, this, that, too much of a headache for the patient and the surgeon. So we don't do any lifting, even for patients. We don't do any lifting on anyone. We do LippyLipo. We give them a great infrastructure. We get rid of the lipedema fat cells. And if they need skin resection 6 months, a year after that, then they will have it done at their home country or their hometown or their home state, kind of where they're coming from. Okay, let's keep on going here. Jans is asking, can lipedema be in the thighs only? Yes. So you have multiple types of lipedema. Type 1, you have buttock shelf. Type 2, kind of from the hip area down to the knees, basically the thighs. Type 3, from the buttock all the way down to the ankle. Type 4, well, you have that and the arms are involved. So can you have it just in the thighs? The answer is yes. Samantha is asking, how much time does each surgery take? So I only do one surgery a day, so I spend the entire day together. And it depends, you know, some are more than others, but I would say on average about 4 hours it takes. You're fully awake for the procedure. And the discomfort is like 2/10 on most patients. Some people might be a little bit more, some people they don't feel anything, but 90% of the patients it's like 1 to 2/10, and all of them are awake. No PO sedation, no IV sedation, just like pure awake. A lot of colleagues I see that joining here, waving, wave back guys, thanks for joining. I love it that we're adding like so much value to a lot of patients, lipedema community, as well as fellow colleagues. Okay, Sister Rexard is asking, is the post-op painful? For how long? And how long do we have to use compression all day? Okay, great question. So post-op, usually the first like 2 days, I'll have patients do Tylenol and Advil around the clock, and they're taking 1 oxy at night after the procedure. So there is recovery, of course. It's still like 5 liters, especially kind of patients who have it. But it's nothing like, most people say it's like getting a tattoo, and kind of like after that, there is a recovery. Now some people can be potentially more tender. So I would say about a week. For how long? Maybe 1 week the recovery. But some people that have done it in a day or two, they're good. Some people a week, some people it takes them up to 2 weeks. In terms of compression, there's 3 different types of people. There's the people who they're gonna use it forever. Especially these are the stage 4 lipo lymphedema, because they're gonna have swelling because they waited so long. It never goes way back to normal, the swelling. The early stages is usually 6 to 8 weeks, and some people kind of in between. And the swelling is usually based on position. If they're healthcare, they stand on their feet for a long time. So they usually use it intermittently, either when they are flying, if they're standing too much, and these kind of like intermittently. So either 6 to 8 weeks and then you're done for life, or you're going to be one of those intermittently using them, or you're going to be one of those where you would use them for life. And that's going to be like 10% of the population, of the lipedema population. Linda is saying, I'm out of country, how many trips would be necessary? It depends on how many lipedema fat cells you have. If you have 20 liters of lipedema fat cells, it's going to be different than if you have 5 liters. So depending on the stage that you need. Most of the times, We are doing, if your blood count is high, we would do 2 stages, 2 sessions in 1 week, one on Monday, one on Friday, and then people will fly back afterwards for people who are out of state or outside the country. But if you have 20 liters, then you might need twice. If you have 10 liters, then we'll be able to do it in one time, in 2 sessions. I do have a patient here to see, but let me try to answer like a few more questions here. Varicose veins from Samantha. What if you have varicose veins also? Most lipedema patients, they have varicose veins. It's part of the disease. So to me, it doesn't matter unless like somebody really have like large this, they start with a low hemoglobin, then we would treat those first. But most people would treat that LippyLipo without. The varicose veins tends to get better. So you don't have to treat it. Sonali is asking ankle pain. Again, pain on tenderness, pain on touch is a sign of a symptom of lipedema. So most patients do have it. So if you have it, usually lipedema, LippyLipo, it helps with that significantly. So I'm gonna have to stop now. They're waiting on me. Again, guys, every great questions, great session. Every Tuesday and Thursday we go live at 12 p.m. This Thursday actually I'm excited for our live. We have a guest from Spain who's awesome. So we're gonna talk about all things of lipedema. We're gonna see kind of like how they do it over there in Europe, kind of what they do, how is it different, trying to learn from them as much as possible. Super excited for that. Again, every Tuesday and Thursday, 12 p.m. Central Time. Anything related to lipedema, LippyLipo, happy to answer it. As always pleasure. Thanks for watching.